What's good, ladies and gentlemen? It's your man CJ, aka the High Value Nurse, checking in once again, back with another video. Now, I am bringing you this video because I want to do something for the people that are thinking about going to school, the new grads, the people who may have just passed the NCLEX and they are ready to look for your first job. First off, let me say congratulations. You had a long road, and I'm very happy for you. And also to the students that may have not graduated yet, keep pushing, keep pushing, keep pushing. That year is going to go by fast, or however long that you have, it's going to go by fast. And it's going to be like it was just yesterday, I promise. But I'm going to talk to you about the one thing that I would not do as a brand new nurse. Let's talk about it. All right, ladies and gentlemen, here it is. The one thing I would not do as a brand new nurse is work at an assisted living facility as my very first job. I think you are setting yourself up for failure if you work at an assisted living facility as your first job. Now, before all the people who started off in assisted living come at me and try to go ham in the comments and everything like that, let me just say, this is my opinion and my opinion alone. Have there been successful nurses that started off in assisted living? Sure. But I personally feel that it is a bad place to start off, because I feel in most assisted living facilities, and let's keep it real, I'm talking about real assisted living to where you don't have a lot of patients that are in critical care. The acuity is not high. I'm talking about people who just need very small things where you're not even utilizing your nursing skills. So y'all know what I'm talking about. I don't feel it's a good place to start as a nurse, because you don't get to utilize the skills. And you don't really get to see the worst of things. You more so see the easier side of nursing. I personally like to call it fantasy land nursing, because it's not really how nursing works out here in the real world. So I just want to recommend you start there. What I would recommend is you start at a place to where you can have a decent amount of patients that have a pretty decent acuity, so you can learn what to do in certain situations as a long-term care nurse, so you can learn how to think on your feet. You need to learn how to take care of the sickest patient in the long-term care facility. You need to get those assessment skills down packed, so you can know when you need to send somebody out. You know when to call the doctor, and really getting that and honing that nursing judgment. And I just really feel like starting off working in an assisted living facility, not long-term care, but assisted living facility, you're not going to really get that experience. I know when I worked in assisted living, all I did pretty much was just some blood sugars, and I just managed the building. You know what I'm saying? It wasn't really like a nursing experience, pretty hands-on nursing experience. So sorry about that, ladies and gentlemen. Duty calls. But yeah, I don't feel like that's a good place to start. I feel like you are really robbing yourself of the experience. And once you do get out into more common parts of nursing, especially being like a long-term care nurse, you're going to be out there looking crazy, because you might have been in a situation where you spent 2 years working at an assisted living facility, things go left, and you get out to one of these nursing homes and you don't know what you're doing. So you kind of want to avoid situations like that, and that's why I really make it a point to try to tell new nurses or nurses just getting into the game, you want to get into if that's your goal, if you want to do patient care, because to me that's where the bag is for LPNs, whether it's travel or local. But if you want to get into it, you need to learn how to take care of a decent amount of people. You need to learn how to take care of people with high acuity. You need to learn how to handle situations between scenes and drama. You need to learn how to diffuse situations. You need to learn how to talk to doctors. You need to learn how to talk to patients. You need to learn how to talk to their families. It's a lot of stuff that you just need to learn how to do when you first get in the game. So yeah, I wouldn't recommend I wouldn't recommend you do that. I just would not recommend you work at assisted living for your first job. But let me know how y'all feel in the comments. Am I tripping? Am I wrong? Let me know how you feel. And if you were a nurse that started off in assisted living and not so much long-term care with a high acuity, how do you feel that it helped you, or do you feel like it hindered you? Let me know. I'm gonna holler at y'all in a second. Peace.